Good morning, my dear students. Starting with the basic videos of the lower limb, I have done with the osteology of the lower limb. Now we'll start with some theory topics of the lower limb. So before starting with any big theory topic, I just want to introduce what should be the plan of the lower limb, because unless you understand the plan of the lower limb, it will be difficult for you to understand things which are there in the lower limb. Now whatever I'm going to talk in today's video is going to be very important, and I would like all of you to please understand this basic concept of the plan of the lower limb, so that you will not make mistakes in identifying the nerve supply or the what type of muscles are there in the lower limb and what is the basic action. So when you talk about the lower limb, one thing you should know, that the lower limb has three parts. You have the thigh, the leg and the foot. Now each part of this lower limb has compartments, and there are specified nerve supply and muscles in each compartment of the lower limb. Now when we start with the thigh first, the thigh has four compartments: anterior, posterior, medial and lateral. Okay, the leg also has four compartments: anterior, posterior, medial and lateral. The foot has two compartments: the dorsum of the foot and the sole of the foot. Okay, now we'll mainly concentrate upon the thigh and the leg, because the group of muscles which are there in the thigh and the leg are important. And what I want to convey through this video is to make you understand that when you understand the group of muscles that are present in each part of the thigh or the leg, you will understand that grossly which nerve is supplying those muscles and what is the general action of these the muscles in this compartment. Now starting first with the thigh, if you check the thigh, as I said, has four compartments: anterior, posterior, medial and lateral. The anterior compartment of the thigh has a group of muscles which is called as quadriceps femoris and sartorius. There is a small muscle which is called articularis genu, but not very significant. So sartorius and quadriceps femoris are the main muscles which are present in the anterior compartment of the thigh. Now sartorius is the longest muscle of the body. It is a very fusiform flat muscle which is going to go from the anterior superior iliac spine up to the tibia. Details of the muscles origin in session I'll take later. And quadriceps femoris is a group of four muscles which is named under one heading, which is called quadriceps femoris. Now what are these four muscles? You have vastus lateralis, medialis and vastus intermedius and rectus femoris together constitute what is called as quadriceps femoris. And the sartorius and these quadriceps femoris together are supplied by femoral nerve. Now here you should understand that femoral nerve is going to supply all these muscles. Now the common action of majority of the muscles in this group, I am not talking of all, please understand this. I am talking about majority of the muscles in this group is extension. So these are extensors of knee joint. Okay, so that is the anterior compartment of the thigh. The posterior compartment of the thigh has a group of muscles which is called as hamstring muscles. Now hamstring muscles are four in number, which are grouped under one heading, which are called hamstring muscles. These muscles arise from the ischial tuberosity. They are called semitendinosus, semimembranosus, biceps femoris and ischial part of adductor magnus. Now all these muscles are supplied by tibial part of sciatic nerve, and they are flexors of knee joint. Okay, so this is a basic understanding of anterior and posterior compartment. Remember that anterior compartment supplied by femoral nerve and posterior compartment supplied by tibial part of sciatic nerve. The medial compartment of the thigh has adductor muscles, and these adductor muscles are adductor longus, brevis, magnus and gracilis. Now these muscles, by their name you will understand that the main action of these muscles is adduction. Okay, and the nerve supply of the muscles of the medial compartment of the thigh is obturator nerve. Okay, and now coming to the lateral compartment of the thigh. Lateral compartment of the thigh has so it's called as a safe compartment of the thigh because it has only one important structure, which is called as the iliotibial tract, and two important muscles which are inserted in the iliotibial tract are gluteus maximus and tensor fasciae lata. So, and that tensor fasciae lata, functions of tensor fasciae lata, we'll talk about later. So this is the general plan of the thigh. Anterior compartment, extensor muscles supplied by femoral nerve. Posterior compartment hamstring muscles supplied by tibial part of sciatic nerve. Medial compartment has adductor muscles supplied by obturator nerve, and lateral compartment has the iliotibial tract, which has the insertion of gluteus maximus and tensor fasciae lata. Now same is the case with the leg. The leg has anterior compartment, posterior compartment, medial compartment and lateral compartment. Now anterior compartment of the leg has a group of muscles which you can remember as a mnemonic as THANDP. Now here A and N refer to anterior artery and nerve. You will not confuse with the names of the muscle. T for tibialis anterior, H for extensor hallucis longus, A for anterior tibial artery, N for deep peroneal nerve, D for extensor digitorum longus, and P for peroneus tertius. Now all these muscles are going to be extensors of the ankle joint. Extensor of ankle joint is called dorsiflexion, and they are supplied by deep peroneal nerve. So that is anterior compartment of the leg. The posterior compartment of the leg has two groups of muscles. The muscles in the superficial group, which are called the peripheral heart, the gastrocnemius and the soleus, which are strong plantar flexors of the ankle joint, and deep muscles of the posterior compartment of the thigh will be remembered as a mnemonic, as talented doctors are never hungry. Now here T for tibialis posterior, D for D is for flexor digitorum longus, A for posterior tibial artery, N for tibial nerve, and hungry, H for flexor hallucis longus. Okay, posterior compartment as flexors. Please remember, if I have made a mistake in talking that, please correct that as flexor digitorum longus and flexor hallucis longus. All these muscles are supplied by tibial nerve, and again they are plantar flexors of the ankle joint. The lateral compartment of the leg has peroneal muscles. You have peroneus longus and peroneus brevis. They are supplied by the superficial peroneal nerve, and peroneal muscles are everters of foot. Okay, peroneus longus and peroneus brevis are everters of foot. Eversion meaning sole facing outwards. And the last compartment, the medial compartment of the leg, this has nothing. This is bare. This is called as the shin of the tibia, and three muscles are inserted in the upper part of the medial surface of the shaft of the tibia, and they are the sartorius, the semitendinosus, and gracilis. Okay, so these muscles, sartorius, gracilis, and semitendinosus, in that order, from anterior to posterior side, they are inserted into the upper part of medial surface of the shaft of the tibia. So this is the general plan of the leg. I wish all of you to go through the plan of the leg repeatedly, so that you will not make a mistake in identifying what is the major action of the muscles, what is the important nerve supply, and which are the important muscles in this compartment of the thigh. I hope you will like my videos, and I will try to be regular in making my videos now. Please kindly share, like, and subscribe to my channel. Thank you.